Okay, we are gonna get started here. Welcome to our webinar, Mommy My Ear Hurts. So this is our first webinar that we are doing, so bear with us if there's any glitches in the system. But I'm gonna ask everybody, if you haven't already, to mute your microphones, just so there's no added background noise, so people can hear everything that they want to hear. And I'd like to welcome current patients and practice members, as well as those that are new. My name is Dr. Kaylee Ritchie. For those of you who don't know, I'm a wellness expert and a board eligible chiropractic neurologist in the Madison area here. And why we're going over ear infections is that they can leave a child feeling helpless. And that constant irritation and pain and pressure associated with those infections can leave them unable to do the things that they love. And as parents, we want to be able to help them feel better naturally and safe. So that is what we are going to be going over today. So let's first start with what an actual ear infection is. And I'm just going to get rid of this on the screen. I'm going to hide, show you, I'm sharing my screen with you here. So what is an ear infection? Ear infection is inflammation within that middle ear, usually caused by um, fluid buildup that gets infected with either a virus or bacteria. Now, what causes that fluid buildup is a whole nother thing that we will be talking about. So, is an ear infection actually more of a bug problem or more of a plumbing problem with inability of the ear to drain? But some of the symptoms of ear infections that can be pretty painful. Here you can see the child pulling at their ears. You can either have a one-sided ear infection or it can affect both ears. So that's one sign, but that's not always the case. Let's look at this is what I actually see when I'm looking through my otoscope looking into the ear. This is the tympanic membrane or the eardrum. You can see how healthy it is. Here's one of the ossicles that you can see. That's the inner ear bones. Here on the right hand side, this is acute otitis media. That's what we call an ear infection. You can see the redness, the inflammation, but also you can see the fluid buildup and the pressure here. You can barely see the ossicles or those ear bones. And you can see how it's bulging. In really severe ear infections that are prolonged, you can get perforations within that ear canal or the eardrum, the tympanic membrane. And when that happens, usually the pain diminishes, but the infection is still there. This is another example of a different type of ear infection. This is where you can see the redness in the external canal here, in the auditory tube. This is treated very differently than those middle ear infections. But some of the signs and symptoms include fever. Fever is a really good thing. That's your body's natural way of helping take care of those invading little bugs. Without fevers, we would be in big trouble. But fussiness, crying, and trouble sleeping are some of the most common things that you'll notice with inner ear infections. Like our little Balaam boy, he for a while he was crying and not sleeping well, and we didn't know if he was just going through his terrible twos or what the case was. But he was also getting some of his molars as well. And I looked in his ear, and lo and behold, he had some redness and swelling in there. And so it was not necessarily the typical signs that you would note. So if your child is having fits of crying or fussiness or just being irritable, they may have a inner ear infection. But also balance and clumsiness problems, when you affect the inner ear, you're going to affect how the body perceives where it is in space and time. That's going to be affected. But also trouble hearing or responding to quiet noise are some of the more common signs and symptoms. But what can cause an ear infection? So ear infections result from more of a primary infection, and the ear infection is secondary to it. So ear infections can come from colds or coughs or sore throats or some type of upper respiratory system, or a decrease in how the child's natural immune function, either through diet or lack of nerve supply. But with ear infections, it's typically not so let's go jump into, is it more of a plumbing issue, or is it a bug problem? Is it the bugs first, or is it the backup of fluid? Typically, it's the backup of fluid. So most medical communities look at it as more of a bug issue, and then they prescribe antibiotics or surgery for it. But let's look at it as more of a plumbing issue, a loss of drainage, the inability of the inner ear to drain. And with that, what creates problems for the inner ear to drain? So those plumbing problems can initiate in utero when the baby is within the uterus before they're born. Here you can see on this left side the mother's posture is incorrect. This red line should line up with all these black dots. So this can create interuterine constraints, which affect how the baby develops and grows, and how they might get stuck into a position or might not be able to move as they freely as they should be, and that can affect the alignment of the C1 and the C2, which is at the top of the vertebrae, and even some of the cranial structures that help and aid in the nose, throat, and ear drainage. When you affect the misalignments of the C1, C2, there's many things that can create problems in those areas. Not only in utero, but the birthing process itself. If you have a difficult delivery or labor, I usually don't like to call it delivery because you definitely don't have your baby delivered to you. It's work. So when your baby is birthed, if it's a long birthing experience or a lot of pushing, or forceps or vacuum is used, that can lead to misalignments and dysfunction within the cranium, but also within the neck too. If the same is true as if the labor is very forceful and fast, that creates a lot of strain on the baby's head and neck. After they're born, slips, falls, bad posturing. Here you could see in the car seat when they fall asleep, they don't have that neck support. There's many problems with this picture, but that's just one of them. You also teething, that creates inflammation and is a breeding ground for infections too, which all kids go through, but we want to minimize the effects that would have and make sure that those eustachian tubes are able to open freely and help with the drainage. And for kids, they're prone to ear infections, and with the eustachian tubes in infants and children, they're more horizontal, while in adults they're more vertical, so the drainage is easier to happen. Now, with otitis media, or in ear infections, we have what are called goblet cells, and those are mucus producers, and they aid in helping the body fight invaders. But after acute bout of an ear infection, you have an increased production of mucus through increasing the number of goblet cells for up to 6 months after that ear infection. So kids are more prone to having reoccurring ear infections because of those mucus producers are producing the mucus and stopping up that natural flow of the eustachian tube. But also diet like milk here, any dairy, those are mucus that aid your body in producing mucus, and so we want to avoid, when you're actually having an acute ear infection, avoid the consumption of dairy besides breast milk. Breast milk is very healthy. but cow's milk, even goat's milk, um, cheese, pizza, any type of dairy that your kids may consume. You want to limit that amount of mucus production. Now, with this plumbing problem, so you have those misalignments of the C1 and that C2, the top part of the neck, which are going to affect the drainage. But there's also a connection with the TVP muscle, which connects on a cranial bone called the sphenoid and on the upper part of the palate and helps with the opening up of the eustachian tube for the drainage. When there's problems within the cranial bones or the sphenoid or the soft palate of how that is positioned, that can affect the drainage and how that muscle functions. Also, the nerves, your fifth cranial nerve called your trigeminal nerve, the mandibular division, which is by the jaw, that is what communicates with that muscle. When there's issues with how the brain is communicating with that muscle, there's going to be dysfunction and drainage issues. So one more thing to add to that too is that when you have those upper neck uh, dysfunctions, it creates tension on the suboccipital muscles, which are on the back part of the head and attach onto the neck, and in the muscles called the paraspinal muscles of the neck too. They go right along and they go right along parallel with the spine and add for stability and posture. But when those are tense, it decreases the lymphatic drainage, allowing for that backup of fluid in the middle ear. Some of the other signs that come with the C1 and C2 misalignments, which you may notice with infections as well, with the ear infections, is infants and babies. You can expect to see acid reflux, more constipation issues, torticollis, which is like a turning or contraction of one side of the muscles in the neck, and the baby's head doesn't quite turn. And you could see that through like difficult nursing or a baby favoring one side more than the other. So those problems create a lack of drainage and a perfect environment for an ear infection to begin. So we look at it more of a plumbing problem than with a bug problem. But ear infections are more a bigger problem than you or I, or that more than you may think. Ear infections are one of the number one reasons that children are brought to the pediatric office. And when you go see your pediatrician, a lot of times in the past they have overprescribed antibiotics. And the number one antibiotic prescribed is amoxicillin. Some studies done by the American Academy of Pediatrics discovered that with the amoxicillin that it doesn't necessarily decrease the amount of pain that your children are in. They're still going to have that pain and they may still have the infection because a high percentage of ear infections are actually viral rather than bacterial infections. And with kids, acute otitis media, it often takes longer to improve clinically than in older children, making the infection even more trying for both child and parents. With amoxicillin, these little bugs are smart. The bacteria, they change and they become resistant to antibiotics. So the more antibiotics you use, the higher the risk of getting a bacterial resistant strain. And with amoxicillin and other antibiotics, it stops the growth of bacteria, not only within the inner ear, if it is a bacterial issue in the first place, but within the gut as well. So there's side effects of upset stomach, vomiting, diarrhea, skin rashes, and more the serious stuff is more seizures and excessive tiredness or hives. And kids are typically put on the antibiotic for about 10 days. But you got to remember that ear infections are mainly a plumbing issue, not a bug problem. So with the antibiotic use, that when it affects the bacteria within the body, especially within the gut. There's a huge correlation with connection with immune system and gut bacteria. So it wipes out the good gut bacteria, which helps in immune function, and they're finding that with higher usage of antibiotics, it's associated with different autoimmune conditions within children. So, like juvenile arthritis is one example of it, but it's also associated with increase in childhood obesity with reoccurring antibiotic use. Now, if children, if they experience reoccurring infections, uh, your pediatrician may recommend putting in the ear tubes, which they actually perforate a hole and put I think they now use like these plastic grommets or tube that helps with the drainage, but that may lead to what they're finding is that the tubes don't necessarily make a difference in the number of episodes of ear infections. And they did a group with between a placebo and a surgery group who got the tubes, and there was no difference between the placebo group and the other group. And actually, what they found with the group that had the surgery, there was added emotional distress and suffering from the limitation of the activities of both parents and the children. So, what do we do? Where do we go from here? If you want a natural, safe way to help with ear infections, there's a couple number of ways that you could do without uh, having the effects of the drugs or the antibiotics. So, how do we fix this plumbing problem? Well, for one, we want to look at what's causing the plumbing problem and address that issue. Is it misalignments of the C1, C2? If that's the case, we want to go in there and we do very gentle chiropractic adjustments of the upper neck. That can be done on from infants from the day that they're born, to 90-year-olds or 100-year-olds. There's no really age limitations on that. There's also cranial adjustments that we do to help with that sphenoid bone that we talked about earlier and with the soft palate. We can do kinesiotaping for lymphatic drainage that helps with, and that's this specialized tape that we put in a specific drainage pattern that the children leave on for a couple days that aids in draining of the ear. And also some infant and pediatric lymphatic and TMJ or your jaw. We can do mobilization techniques that help with opening up the eustachian tubes, aiding on the drainage. So that's things that we can do within our office to help when an ear infection is acute, or if your child is having an upper respiratory illness, that to help prevent it to spreading into the ear. Home remedies that you can do, because this is very important. How can you get your child to feel better at home without the use of drugs and help increase the drainage? But a hot warm pack, like our daughter Ailish, she loves sleeping with a hot a warm water bottle. Even though she might not have any ear infection or have any pain, she just likes it. It relaxes her. But it also helps with opening up the eustachian tube, allowing for that drainage. You can also raise the head of the bed. You don't want to prop pillows up within their bed, but underneath their mattress, you can put books or pillows to raise the head of the bed, which will aid in the drainage. If you notice that the pain of ear infections is worse at night, not only because they're calm and quiet and they notice their aches and pains more, but laying down builds up that pressure within the ear. You want to make sure that your children are staying hydrated, so drinking plenty of water, not only for their body functions and the immune system, but that swallowing actions. You can try it right now. Just take a gulp, and you notice that it helps open the eustachian tube. There's gentle massage for lymphatic and the the jaw that you can do to help with mobilizing, that we can teach you if you when you're in the office. We can teach you how to do that at home to help with the opening of the eustachian tube. There's garlic eardrops that can be used. That doesn't necessarily affect internally within the middle ear, but it can affect if the infection goes into the ear canal. And garlic has a antibacterial property. But supplementation, so probiotic supplementation and vitamin C are great supplements to give to your kids. And the probiotic, you want to make sure that you have that good gut bacteria to help aid in the body's natural response, immune response. So what do we do to be preventative in ear infections? The care that you do while there's an acute ear infection is great. But what we really want to do is prevent ear infections from ever occurring, or prevent the reoccurrence of ear infections. And the number one thing that you can do for your child when they're an infant is breastfeed. So it's not only getting that actual jaw motion of physically when the baby nurses, but the breast milk has so many nutritional properties that formula doesn't have. And the immune benefits, giving your child immunity, or helping the child's immune system while it's developing through the breast milk. Also, stopping the use of pacifiers after 12 months. So that pacifier usage, it's not mimicking the same motion as chewing. So you're not getting that jaw movement or swallowing. It's more sucking, and it sucks bacteria into the back of the throat, which can create a breeding ground for infection, leading to more ear infections. But also sitting up when drinking, not having your child lay down with a bottle. Also avoiding dairy products. Remember those goblet cells that are the mucus producers? Dairy increases the production of the mucus, which can aid in blocking that drainage. And avoiding, of course, secondary hand cigarette smoke. But eating plenty of raw fruits and vegetables at every meal, making sure that not only are those are called prebiotics, they give food for those fibers are the food for the bacteria in your gut, but also it helps supply the kids with healthy nourishment through the vitamins and minerals that they get. And proper hygiene is really important for preventative care, with daily hand washing, and making sure brushing the teeth every day as well, especially after eating, can help prevent infections from occurring. Now, supplements for preventative care, a good preventative care for any child, what we have all our kids on, is a general multivitamin, which gives the basic nutrients, a probiotic to make sure that they have the good gut flora for their immune response and other vital functions, vitamin D, and a cod liver oil supplementation. Those all are basic nutrients that aid in your body's natural immune response. And of course, we have you want to make sure that the spinal alignment and optimization of the nervous system, so that the nervous system controls everything, and it controls the immune system as well. So making sure that there's nothing interfering with that. And chiropractic adjustments don't necessarily have to be for pain. They can be for wellness too, to help with how the brain is communicating with the body, and making sure there's no interference in that, and so that it optimizes the neurologic component of how the immune system functions. So, with ear infections, the key points to take away from this is that it's more of that plumbing issue rather than uh, a bug issue. We want to get to the root of the cause of what's causing the loss of drainage from the middle ear, and what can we do to prevent that, and if an infection does occur, how we can help our child through that. And ear infections, they do resolve by themselves. If they didn't, if our body wasn't able to handle that, again, we would be in big trouble. So if there are any questions on anything, before we go into that, I'm just going to, before I open up the line, I just want to go over some upcoming events that we're having. We have a smoothie making workshop, and of course, all of our workshop and events are free. Uh, we have the living the 100-year lifestyle and sprouting new habits teleseminar that's about creating family habits that help build healthy families, and then a natural parenting workshop that we will be doing in the office in July. And to go to any of these events, you just go to arcoflifechiro.com right here, and you click on events, which would be on the home page, and you can register for the upcoming events as well. And here's all my contact information for those of you who are not our current practice members. If you'd like to get a hold of me, if you have any questions, or would like to talk one-on-one about ear infections or any of the information that we've gone over, you can give us a call at the office, which our number is 608-441-3455, or you can contact me through email at drritchie@arcoflifechiro.com. And here you can check out our website down below. But what I'd also like to offer is give everybody a one-time special deal if you'd like to come in and have your children checked or have yourself checked as well, and see if there's anything that we can do to help improve the health of our little ones and prevent them from becoming antibiotic resistant carriers for those little microbes. We want to prevent them from ever having to experience that. So you can give what we're offering is $25 for a consultation exam, and we would give you recommendations at that time too. And you can call our office to schedule and or for more information on the $25 deal, and it does include any x-rays if necessary.